AI user group meetup, get together. I'm Madisa. I find myself in a unique position of introducing the speaker for today, which is me. So today I'm going to be talking about the most bland subtitle in the history of presentations, AI and women's health. I would like to preface this by saying I'm an expert in, my expertise is in women's health and not AI. So feel free to interrupt me with questions, or if you have something to say that you know better about than I do. I would like to look at this presentation as less as possible. Yeah, so I work as a bioengineer at AI Nexus, and that's where, women's health, etc. Okay, never done a presentation here before, so please forgive me for being really clumsy. Yeah, so why did I want to talk about AI in women's healthcare? Since we've started doing the user group, we've talked about ChatGPT, we've talked about LLMs. Jacob had a really great talk about how LLMs work, but I don't think we really focus on how we can use AI in healthcare, particularly women's health. So I wanted to talk about that a little bit. And why is that important? I wanted to talk about that first before we get into actually talking about AI. So I got to know this very recently, but do you guys know when we started to include women in clinical trials as subjects? Any guesses? Any throw out random dates if you can?
2005.
2005. That's very recent. Yes.
1975.
We're in between those two numbers, so still bad, but we're a little bit better than 2005.
1988.
A little higher than that. Yeah, we started including women in clinical trials in 1993, which is like, how many years ago is that? I don't know. 19 years ago. Which is kind of crazy to think, but it's not so bad when we get to know that clinical trials have been in effect since the 1940s. So 53 years for people to start being like, oh, maybe we should start testing these on women. Why only until 1993? First of all, people were like, you know what? Women probably don't want to be included in clinical trials. They didn't ask, they just assumed. They just kind of assumed that we would do these tests on men, and women are just smaller than men. So, same thing, smaller doses. The actual scientific reasons for not including women in clinical trials include them thinking that it's not going to make any difference to the medications, them being concerned over having to study hormonal fluctuations and having to time clinical trials to those things. It says concerns on my presentation, but I would like you to read that as lazy to research hormonal fluctuations. And also concerns over subjecting women to drug treatments that we don't know what effect they'll have on women. Might affect their reproductive health, which is fair, but it does kind of give me okay, how will you find out if this drug is good for pregnant women if you can't test on pregnant women? So it's kind of a chicken and egg situation, but we did start including them in 1993. What are the consequences of including women so late in clinical trials? Tampons. We didn't know they had metals and metalloids in them until last month, 2024. To put that in context, they have been in use since the 1930s. So why are there metals in tampons? It's because of the cotton being grown in fields that have contaminated soil. So yeah, great news to find out in June 2024. Another really interesting thing that we found out is that heart attacks present differently in men and women. Who knew? Who knew? And women are 7 times more likely to be misdiagnosed when they're having a heart attack or dismissed at the emergency room. Yet another example is, of course, differences in drug reactions. Women are twice as likely than men to have adverse effects to drugs. Examples for that were, I think, aspirin, we're supposed to take less of a dose, and Ambien, again, we have to take less of a dose. Of course, if we talk about women being excluded in clinical trials and evidence seeking, then we also do have to talk about other minority groups that have also been not included in clinical trials, or sometimes even abused in the name of clinical trials. So because of these and other prevailing biases in healthcare, we have gaps in women's healthcare. For example, chronic conditions. Women are more likely to have chronic conditions and also more likely to be dismissed at the doctor's office as we're being hysterical or you're, inflating your symptoms and things like that. Autoimmune disorders, again, women are more likely to get autoimmune disorders and suffer more because of it. I don't have the numbers for these, but I can look them up. But the rest of the slides are very well researched. We also have a lot of procedures that are diagnostic in nature that are very painful for women, primarily because I think the people that developed it were not women. Breast cancer screenings, a mammogram is extremely uncomfortable. Pap smears, I don't even want to talk about that. We also have gaps in accessing and receiving care, especially when you add a factor of racial disparity or economic disparity, it's even worse. And to top all of that off, we've just found out that life expectancy is lower for women than men in general. And it's even lower when they get married, apparently. So, crazy. So, of course, to come to the actual topic of the conversation, what are people doing to close the gaps? And specifically, how are they using AI to close these gaps? So I can talk about some of these in depth. Again, I'm not an expert in AI systems, so feel free to chime in with what you know with things that you're doing in your workplace. One of the first things that I wanted to talk about is, of course, data sets. Using AI to either extrapolate data or wrangle data or make mundane tasks automatic. So some of the examples for this include not having a representative data set. So if we don't have women that are showing up for clinical trials, or we can't get, we don't have enough data on women, then there are algorithms that are being researched that can kind of extrapolate that data and put those findings to the test for women. Also, freeing up people to do more research and more efficient and more important tasks by using AI to actually take away the mundane tasks. This is my favorite use for AI. Also, one of the other things I wanted to talk about, which I will talk about in detail later in my presentation, analysis of personal data. So using personal markers to bridge gaps in healthcare. Of course, if we're talking about AI in healthcare, we have to talk about image analysis. Again, I don't know much about this, but I do know a lot of companies out there doing breast cancer screening, cervical cancer screening. Those are just some of the examples. I think Panakia is doing biomarkers for breast cancer, which is kind of cool. I will be talking about VARA and Deep Look later in this presentation. Simulation includes drug simulations, simulations for treatment plans, surgical treatment plans, and things like that. And of course, support for clinical decisions, which includes risk stratification. For example, there's lots of gaps in assessing who is more at risk for certain conditions. So you can use AI to kind of say, this person, not that person. Diagnosis support, again, cervical cancer, pap smears, using not just image analysis, but actually analyzing the results that you get from the imaging that you've just done. LLMs are being used to give advice to people, to talk to people about their treatment plans, about their medications, lots of educational content, etc. Oh, that's not great. That's the logo. I don't know why it did that, but that's the logo for in vitro, which I wanted to talk about. In vitro is doing a really cool thing where they're looking at women who are trying to conceive using IVF. And as we all know, IVF is really expensive, requires multiple rounds of trials. So in vitro is like, you know what, we're gonna try to make this more efficient so that people don't have to spend a lot of money on this. So they look at personal data given by the women. So they take in account their genetics, they take into account their cycles, tracking, their changes in hormone levels, and then they put all of that data into their algorithms and try to find the best possible times for extraction or best possible times for giving certain drug treatments and things like that. They have a platform, they have a database, and if you go on their website, you can actually play a little game, which I was confused about what you can select. They show you pictures of embryos, and you can select which one you think is viable. You do have to sign up to get a result, so do that or not. So in vitro was kind of interesting in they're using AI to do to make IVF more efficient. It's doing that again. I was just trying to give the logo. Anyway, Deep Look Medical, also really cool. They're doing breast cancer analysis. So they're looking at mammograms of people, and it's supposedly better than the computer, supposedly also better than the radiologist who's looking at the mammogram. They have numbers there for how many shades of gray the human eye can see and how many they're able to see with their algorithm. So it's supposed to reduce the number of times that a woman has to go in for a mammogram, reduce the number of false negatives as well. And really cool that it goes on all platforms. If you take an ultrasound, an MRI, or a mammogram, Deep Look can actually piggyback on that software, which is why I said it's multimodal. Another company called Thara is doing similar breast cancer diagnosis, but their platform has a lot more products. They have like a dashboard, they have screenings, etc. How does this keep fitting? Okay. They do, their focus is on triage, so they look at people who have more of a risk to be, getting breast cancer, and they try to reduce, again, the number of scans that a woman has to take in mammograms. I would rather do this than have to take several mammograms, so I'm sure there are people out there that really appreciate this. I did find out that they find 40% of interval cancers, which I thought was really interesting. I had to look up interval cancers and what that means. But basically, if you go in for a mammogram and they don't find cancer, and you go in for another one at a later date, and they do find cancer, it's possible that either the tool has missed it or you developed cancer in that time period. So their work, their algorithm catches those cancer screenings that fall through the gaps. Another thing I really wanted to talk about was the US's maternal mortality rate, which is slightly high compared to other developed countries. According to the CDC, it's 32.9 deaths per 100,000 births. But somebody else went in and reanalyzed that data, and they're now saying that it's 10.4. As a non-American, I don't know if NPR is a reliable source, but NPR was the one that was like, no, it's okay, I got a thumbs up. It is a reliable source. So they're saying it's 10.4 deaths, but that's still pretty high when you look at other developed nations. We do have to take into account that the ways that you measure these metrics are slightly different. And of course, COVID contributed to a lot of these deaths, but still pretty high. We don't want moms dead. So that's a graph for what the racial disparity is. So even if the number is lower than what we expected, the numbers are still high for other racial groups in the US. So that just means that different groups of people are receiving care differently, which AI can probably step in there and try to get that fixed. So one of the more common causes for maternal mortality is preeclampsia, which is mothers getting high blood pressure while they're pregnant, and that having an effect on the birth and the delivery. So there's two companies that I could find that have said that they're doing that are using AI to kind of tackle this problem, Ascertain and AI Preemie. They don't really have products up yet, but I couldn't really find anybody else. But this is like a gap in healthcare, specifically women's healthcare, that AI could possibly address. How will they do that? I don't know, but it's good that they're doing that. Roche, which is pretty, everybody knows Roche. They are doing cervical cancer. They're using their AI platform to sort of triage cervical people at risk for cervical cancer. So this is a blood test and not a pap smear. So you take the blood test, and if you have the high-risk HPV gene, then they'll bring you in for a pap smear. I thought that was kind of cool. They have like several rounds of testing, and they try to take into account all of the false negatives and things like that, and they bring in only the people that are like, okay, confirmed, you do have to get this test. I would rather do a blood test for cervical cancer than a pap smear, although I actually don't know. But there's definitely people that would want to do a blood test over a pap smear. So that I thought was really cool. Of course, when we talk about AI in healthcare, we do have to talk about the ethical concerns and bias in healthcare. So some of these include trying to comply with HIPAA compliance laws. So we don't want to tie patient data to the patient. We want to de-identify that data. Protect patient privacy, of course. Informed consent, which I thought was kind of cool, because I did run into that problem when people were trying to explain to my grandma that, hey, we're going to cut your knee open and replace it, and she was like, wait, what? But yeah, telling people what's going to happen with their data, which is important. Misuse. There's lots of ways you can misuse. I'm not going to tell you any of those so that you guys don't get ideas, but especially when it comes to things like using in vitro, which was the IVF platform that I spoke about. You're giving a lot of personal information, your ovulation, your fertility cycles and things. You want to make sure that your data is in good hands and that nobody's going to misuse it. Something else I found really interesting was tone of voice. When people use LLMs to make their educational content, their advice plans, treatment plans, especially to women, children, or older people, it becomes kind of impersonal and just like very standard generic lines of like, hey, you need to take your medication at 8 a.m. tomorrow. And the moment you find out that it's not actually a human person talking to you, it sort of brings this bias for yourself that, I don't know if I want to trust this. Of course, bias in the data sets themselves. This is a huge problem, not just for women, but also other minority groups. There are all of the data sets currently, most of them, are being tested on white male populations. So you have gaps in healthcare there. Your medications are going to be based on what is suitable for a man, or treatment plans, surgical plans, all of those things are based on how men would react to those. So the data sets are not representative. And you can tell I was scraping the bottom of the barrel here for this slide because I've made 2 typos. But something, an example that I found on the internet was Babylon Help. I don't know if people know about this, but it's a AI algorithm platform supposed to be really reliable and was also referred to by medical officers, ended up misdiagnosing women that go into the emergency room as they're having an anxiety attack or a panic attack when they were actually having a heart attack. So, because symptoms for a heart attack in men and women are completely different. There's no chest pain sometimes, there's no left arm pain sometimes. Sometimes it's just like a mild backache, and then go to the emergency room and they're like, go home, take an Advil, sleep. So this was in the news, and I thought that was kind of scandalous for such a huge health platform to be like, this is an anxiety attack, not a heart attack. Another example, I was trying to find specific examples for gaps in healthcare for women, and where AI can sometimes have bias specifically for women's healthcare. So one of the examples I found was that when you do chest x-rays in men and women, it's more likely to correctly diagnose thoracic conditions for men as opposed to women, which is crazy. But when you talk about, there's other more generic examples for bias, of course. Skin color, not being able to account for skin color differences, specifically for imaging platforms, or body types, again, surgical plans being modeled after men, which is a problem. Which is why it's kind of cool that there are AI platforms that are coming up with algorithms and solutions that are specific to women, including the cervical cancer one that I talked about. Yeah, that's all I have for the presentation today. Please ask me questions. I have lots of time. But I was just hoping that we can use this presentation to facilitate a discussion about any of those slides or anything else that you want to add about AI and women's health.
It doesn't include women, but special needs too, like women, and especially women with like ADHD or autism or something, also have a huge problem. Like my aunt, I take my aunt all the time to the doctor, and she tends to joke and use sarcasm a lot, and so doctors frequently disregard anything she has to say because they assume she's not in a lot of pain despite how much pain she's in. And so it takes several visits to find a doctor who's going to help her.
Yeah, and it was only recently that we found out that ADHD and autism present differently in women and men. So the standard like hyperactivity and things like that don't really apply to women who have those conditions. And tying that to like chronic conditions and like people with neurodivergence are more likely to have then develop chronic conditions. It's like a huge just like gap in healthcare. I would also like to add that endometriosis diagnosis is like, it takes 10 years to get a proper diagnosis next to you guys nodding. Which is like, it's crazy. We need to get better, we need better ways to get that diagnosed.
The thing that I see with respect to AI is sort of a democratization of access and analysis to medical thinking. And it doesn't give you the end-all be-all of what the doctor is going to recommend or prescribe. But if you think about the shift from, okay, we don't really know very many things to, now we have access to the internet, so we have a lot of information. And now we have access to analysis tools, right? And we also have the ability to sequence our genome. We have the ability to work on personalized medicine. So if you have an individual with special needs, you find out what the deletion is, or microdeletion, or what have you, and then you compare it to other situations. And so I think it's an ideation tool. Doctors are trained in a certain focus in a certain way, and they have to have those skills. They need to have that understanding of biochemistry, the processes within the body, and they have the big picture, and they're the professionals. But they keep doing this all day, every day, and they have 15 minutes to see you. And so I think artificial intelligence, like the internet in a way, is going to facilitate democratization of and better access to individuals who want to pursue that, to figuring out their own healthcare issues, asking the physicians questions, and end up with situations where you can have a personalized medicine opportunity. And I think sometimes that could help pivot away from the data that was built before 1993 on men, or it could help somebody who's 82, extrapolate that data and look at that study that was done on people from age 40 to 50 or whatever, or 30 to 50, and think about how that would apply in an older individual. And then you come up with a list of questions, you run them by your doc, see if they like it, or it's an interactive process. But I think there's just a huge opportunity consumer-wise to use this tool to end up with a personalized approach to medicine that previously wasn't available.
Go here. That was a really good point, and also that's where making mundane tasks automatic is going to free up doctors for doing more important things, and also triage, like trying to find out which of these people in the emergency room are more in need of immediate care. It's probably where we could use AI instead of we're doing generative AI and stealing artist jobs. But any more questions?
Thank you, Manasha, for these very, very applicable and real-life critical issues, like discussing these things. These are real. And like certain things like actually creating unnecessary fear also is something very common. I have heard of among a lot of others. And also misinformation and humongous consent forms. You don't have time to read, you have to sign, you don't know what's in there really. When you go home, you have to sign for something you don't want to give consent, kind of an issue. These are really, really good points. And what does, I'm trying to understand what AI Nexus does. Can you might have given, I didn't pay much attention because of food. So if you can do a little introduction of what AI Nexus does, thank you. About these kind of things.
Okay. My boss is like sitting right behind you. I did not prepare for this. So what we do is AI in healthcare. We have a range of, we have platform products. One of those include taking a face scan and getting your biometrics from just a face scan. So you can get RR intervals and respiratory rate, heart rate, and also certain types of arrhythmias from just a face scan. We are trying to address some issues in women's health specifically. I'm working on projects for understanding menstrual health and menopause and pregnancy in women. What else?
Nailed it.
Does that kind of answer your question?
Thank you so much.
Yeah.
I think somebody. Pass it to you.
Thanks, that's a really interesting talk. So, yeah, the one thing that I think is important to think about is, you know, a lot of the people are like, oh, it's AI, I'll write a computer program, I'll fix everything, I'll be going on in the background. But as a physician and as a consumer of healthcare, I think people are really entitled, at least in this country, to a broader understanding or specific understanding of who's behind the curtain doing those things. Because we really have a lot of explicit liability here. So, and it's jurisdictional by state, okay? And if people are board certified in something or not, you know, who's informing the algorithm? How often is that checked and who's accountable? Because like this Babylon situation where people missed heart attacks and somebody died or could have a stroke or some other really debilitating outcome from, oh, I'm going to rely on the computer to play doctor. That's a problem. So I just really hope that people who are doing this type of technological advancement are really considering including physicians, because I'm shocked when I look at the amount of research at even NIH and NSF where they're like, oh, we're doing medical research and this would be so cool and it'll fix something other, that they really exclude the licensed experts that, you know, keep up licenses and actually treating patients. It's like if you were making education software and weren't involving active teachers, okay? But this has a lot more profound effect because it's life or death. And so I just really wish people were a little bit more confident or investing time and money in including that voice, because it's really the most authentic voice to protect the patient from, and the company from liability.
I agree.
I did want to say that that's also one of the reasons why there's such a focus on explainable AI and not just like black box algorithms where we don't know what's going on inside, but more rule-based, or I think we've spoken about the rule-based algorithms, or things where you can kind of find out, hey, you gave me this answer, why did you say this? So there's more of a focus on bringing algorithms like that to the table as opposed to just like black box machine learning algorithms, and also including, like you said, including physicians and doctors and nurses into the discussion and making it more of an expert-based system as opposed to just standard, yeah.
Well, first I want to say thank you so much for your talk again. This is such a critical topic to be bringing into the space, both of AI and in medical research, saving as to how women have been excluded in the past, like you pointed out. Something that I do think is important to mention here that comes to mind specifically in the current political climate in the US is protection of women's information about their cycles and about ovulation and fertility, given the increased criminalization of access to contraception, to abortions, even to seeking this kind of information outside of their state that we're seeing. And this is resulting in people increasingly losing the trust that they may have had or continuing to distrust entirely electronic kinds of solutions that track this kind of information. So I'm really curious to see or to hear from you, or to just look into in general, how AI-specific companies are looking to protecting this specific kind of data for women.
Walk around a lot. I don't know how to answer that particular question because it's something that's been plaguing me as well. I know women have there's a section of women that have started boycotting period tracker apps because in their forms of consent, basically they can give that information out to anybody that asks. Or even something that I found really crazy, and it's kind of a tangent but really related to what the issue that you were talking about is that car companies, there's like a list online of car companies that will give out the information of where you've gone to people that ask. There's only certain companies that don't, that like protect the privacy of the person who's using the car. So that can be used to criminalize me going to somewhere, I don't know, to do certain things. So that's something that's like, you have one.
I just have one other point.
Yes, I don't know, I think I lost what I was going to say. But yeah, people are boycotting Flow and other period apps, and yeah, we really need to look into how exactly, it's also a really new landscape and a constantly changing landscape. So I think when Alan Singleton gave his talk about IP law, this is like very relevant to that too. Like we need to change laws to kind of fit what's going on in the AI space right now.
That's a really good answer. And just one other thing, you know, I know when people go into the hospital or the clinic and they sign a consent, and you know, when you really look at that consent, it's like soup to nuts, you're giving them permission for everything. I never sign that consent that has those things on it. You have the right to go through and cross things off and initial it, and they'll scan that in. I mean, you ask them, please print this out for me, and I'm gonna take off these things. Because there's no reason, they have way too much information on you and access to your phone number and your insurance and your home, all these. As a matter of fact, I would do any of these types of things as a patient. I would make up a fake name and email address where that is really peripheral to me. I'd make up a fake birthday and like keep track of it somewhere on the other side so it really never is linked to you. But don't feel you have to sign those things when you go in or give permission for all the medical students to see you or all the whatever. You can go in and customize that. They might not like it a whole lot, and they might have to ask somebody, well, how do I print out the consent? But they have them. But I never give consent for that type of thing because it's way too broad. Just read it sometime, it's horrifying.
Yeah.
Thanks, Vanessa. Great job. Way to go. Just a quick plug for AI Nexus, and also comment on both Dr. Jones's comment on dependency on doctors, and comment from over there about the data usage, and especially with government agencies, and what that data can be used for. I think that you know, there's been kind of a conflation with, you know, AI and machine learning and deep learning based techniques that are very data heavy, and as those technologies have become more prolific and more prevalent, and it's great that they're way more accessible, there has also been some bad behavior by a lot of businesses taking in information they don't necessarily need, seeing that as a monetization channel, or potentially even now, you know, given the political environment, other ways to kind of distribute that information to groups that may not need it. So there are other approaches to AI that can either leverage or augment these kind of data aggregation techniques, or avoid them completely and rely more on kind of, you know, fact-finding, investigation, and reasoning. That, you know, some of the work that we do falls into that category, but hopefully in the more broader AI environment, those technologies start to become more in vogue and more prevalent as people become increasingly aware. And as the old adage goes, if the product's free, then you're the product. I think people are more, you know, becoming coherent with that, and especially given some of the concerns raised by both Dr. Jones and the person over there.
I was just going to say, sometimes the information they take is not even relevant to what information is given out to you. For example, the Oura Ring, I think, for people that are male, it sometimes gives you period tracking. So they don't know what they're doing. There was also a company that I cannot find right now, but it's an AI-based company that helps people protect their privacy, protect their information, which I thought was a little ironical that they're an AI-based company that does that for other AI-based companies. But yeah, there's definitely people out there that are bringing up awareness about it and like making products that are geared towards that. For example, David's presentation last month about like deepfakes and like how their product is specifically geared towards trying to fish out those deepfakes and make it more reliable, make identification more reliable. But yeah, any other comments? Oh, good time. I think if that's it, then I'll stop here. So thank you all for coming. We meet every second Friday of the month, 12 p.m. here. You can contact any of those people, Brad, Makeup, or me, with our emails, through our emails. And yeah, please come back next time as well. I was not expecting this crowd in the summer, but I hope we'll keep adding more members to the group. Yeah, feel free to come talk to me after if you have any questions. Thank you.